Good afternoon, good evening, everyone. Welcome to the Functional Solutions Podcast. I'm Dr. Sarah Ellis, and I'm joined by my co host, Dr. Tall. Tall, how are you doing today? Oh, I think you're muted, unless you make sure it's not on my end.
Yes, now you can hear
Okay,
me.
cool. Awesome.
Yes, doing well, doing well. It's nice and sunny, getting warmer and warmer here in the Northwest, which
Good.
is always a blessing. So yeah, doing well. I'm glad to be here, talking about the more about the root causes in the functional medicine approach and some integrative medicine strategies.
That's
Um,
right. Yeah. I think we swapped weather the last few days because we had so much rain yesterday and the day before. But I'm so glad you guys are getting some sunshine up there.
mhm.
And as usual, we are joining you all. We join you every Wednesday to share our clinical science based strategies to help you, as a functional medicine practitioner, support your patient's journey to optimal health. And this week, we have a really great topic, and it's about a condition that is one of the more common autoimmune conditions in the United States. And we're going to talk about lupus, systemic lupus erythematosus. I'm always kind of tripping up over that last word, or SLE. We're going to talk about lupus tonight, and specifically, we're going to talk about three root causes of lupus and exacerbation of symptoms, increasing disease severity, all of those things. And, we chose this topic because lupus is one of the autoimmune conditions that affects so many people. In fact, lupus is a chronic systemic autoimmune disease that affects nearly every organ system in the body. The most common form, systemic lupus erythematosus, results in the immune system beginning to attack multiple different organs in the body. It can affect the skin, joints, kidneys, and the brain. And in the United States, it is estimated that 1.5 million people are living with some form of lupus. Unfortunately, lupus disproportionately affects women. In fact, you'll probably never guess this, 90% of patients that have lupus are women. And in fact, particularly Black, Hispanic, Asian, and Native American women tend to experience more severe disease and also tend to have worse outcomes. Now, clinically, lupus can present with a wide range of symptoms. And unfortunately, those symptoms often mimic other conditions. But common signs include fatigue, joint pain or joint swelling. You may notice, or everyone tends to notice, a photosensitive rash or that butterfly rash that appears across the cheeks and the bridge of the nose. Unfortunately, patients with lupus may also present with oral ulcers, hair loss, fevers, and unfortunately, lupus can also involve the kidney. It's called lupus nephritis, excuse me. And we often see that in more moderate or severe cases. Now, conventionally, treatment for lupus usually involves some sort of immunosuppressant or immunomodulatory prescription drug, and that's aimed at controlling flares and preventing organ damage. So, if you have any patients with lupus presenting into your practice, they will likely be taking a blend of NSAIDs for pain and inflammation, hydroxychloroquine or antimalarials that are often used in patients with lupus, steroids, immunosuppressants, and in some cases, biologics as well. So we chose this topic because unfortunately, lupus does have quite an impact on our patients throughout the US. So let's take a look at this picture from the Lupus Foundation of America. We can see here that an estimated 1.5 million people have lupus. If we were looking at 10 patients that had lupus, 9 of them would be women. And it's important to know that men can also develop lupus. In some cases, their response to treatment and clinical presentation may look a bit different, but they can develop lupus. And interestingly enough, 15% of individuals that are diagnosed with lupus are children. So there's a broad demographic of people that are affected by lupus. What's interesting is that while lupus does predominantly impact women, it's important to note that it strikes women during childbearing age. And so researchers have begun to sort of investigate the connection between the hormones involved during the reproductive stage and the impact that being a woman and having the female sex impacts the development of lupus. So, as a functional medicine provider, we are in a unique position to provide our patients with a toolbox that can help get to the root cause of autoimmune conditions, specifically lupus. And so, that's one of the reasons why we chose this topic, because the treatments that are offered for and to these patients, while they may reduce symptoms and progression, they do not address the triggers that have caused the development of lupus. And that is where functional medicine can offer additional insight and, in some cases, provide better long-term solutions. So, in other words, instead of trying to suppress the function of the immune system, we're going to try to figure out what is causing the immune system to attack our own cells and then correct that. So let's get ready for our first quiz of the evening. All right. So which of the following statements about systemic lupus erythematosus is true? A, SLE primarily affects men and is most common in Caucasian populations. B, SLE is an autoimmune condition that only affects the skin and joints. C, approximately 1.5 million people in the United States are living with lupus, and the majority are women of color. Or D, the primary treatment for SLE is antibiotics. So take a moment, hop into the chat, put in your answer, A, B, C, or D. If you have difficulty finding the chat, look for a button that says watch on YouTube, select that button, and once you're in the YouTube app, you can comment in the chat. All right, let's get our answer. Our answer is C. I've said it quite a few times tonight, but over 1 million people in the United States have been diagnosed and are living with lupus, and unfortunately, predominantly affects women of color. So, Dr. Tall, as a functional medicine provider, I actually see quite a few autoimmune patients in my practice, and I actually really love working with autoimmune patients. There's this sort of like satisfaction you get from kind of calming down that inflammation and kind of bringing balance back to their system. How do you approach working with autoimmune patients in your practice?
Yeah, that's a good question. I'm so glad that you, in the introduction section, you described the two main reasons why we chose lupus, an autoimmune condition, right? And one of the main reasons is because of the known impact of some of these medications. That includes side effects, or it could also include the fact that there are so many patients on autoimmune medications and steroids or immunosuppressors, biologics of some sorts, and they're still struggling despite the medication, despite the recurrent costs of healthcare services, right, and drugs and all of that stuff. And for us, the satisfaction that you're talking about is really the ability to sit in front of a patient and take a different approach. Instead of saying, okay, here's another something you can take for lupus, we take a completely different approach, which is sitting with the patient together, and like a detective, right? Our job is to help the patient to better understand what is it in their lives, right? That could be something they're exposed to, something they're eating, something that they're doing to themselves that either contribute to the development of the disease or maybe trigger the flare-ups, right?
Exactly.
So that's really a big part of, once we are able to better understand the mechanisms, the pathways through the functional medicine lens and sometimes the integrative medicine lens, we are able to offer, I would say, more of a longer term solutions, because if you can educate your patient on what they need to do to reduce the flare-ups, they're going to be very grateful for you, for your services, right? And it makes sense when we think about it, when we talk about other diseases, right? If a patient comes to see you with emphysema, for example, they're sitting in front of you and you're trying to provide the best possible treatment protocol for them, right? And then they mention that, oh, by the way, doc, I'm still smoking 15 cigarettes a day, right? What would be the first thing you're going to tell them, right? It's probably going to go somewhere in the line of, oh, by the way, important to mention that smoking cigarettes is known to damage your lungs. It can increase your emphysema, contribute to your symptoms, continue to progress down the disease pathway. So what can we do? What can you do to figure out how you can reduce your smoking, or who do I need to refer you to get that done, taken care of, right? But because it's important, it would be counterproductive to prescribe any medication for emphysema or asthma if the patient keeps on smoking, right? It just makes sense.
Yes.
The problem is that when we come to other diseases, other autoimmune conditions, more specifically, we don't take the same approach. It's almost like we want to completely ignore all the different root cause factors and say, oh, you know what? Here's your medication. We'll see you in 6 months. Good luck. And again, I'm oversimplifying it. I know that we're having conversations on the call with our admission advisor team, and you and Dr. Chill are doing coaching calls, and all the practitioners that we encountered really have the best of, they want to offer the best care to their patients.
Yes.
Right. That's really, they have a good heart. They got into healthcare to help people. And I feel like when we apply functional and integrative medicine to the autoimmune conditions, that's one of the biggest satisfying factors, to actually see the patient improve.
Yes.
Right. And get better, and now understand their body better.
Yes.
So let's go into, and this is why we're here, right?
Exactly.
So let's go into some of the risk factors, and then dive a little bit deeper in the functional medicine lens. So the general risk factors, as we all know them, there's always some sort of always some sort of interplay between our genetics, and then there's our environment, and that include multiple things, and then our endocrine system and immune function or dysfunction, right? There's always this interplay between those systems. Now, what's causing the shift between those four systems? That's something that's what we learn in functional medicine, right? But the general, textbook kind of risk factors are sex and hormones, right? 90% of lupus cases occur in women, especially during reproductive years, which some suggest might indicate a strong hormonal or endocrine link, particularly estrogens as immunomodulatory effect. Ethnicity also plays a role in the development of the disease. So individuals of African, Hispanic, Asian, and Native Americans descent have higher reported prevalence, earlier onset of the disease, and sometimes more severe disease presentation in comparison to Caucasians. And then genetic, of course, with most chronic conditions, there's somewhere there is some sort of genetic predisposition. And this is not an exception, right? Family history of lupus or other autoimmune diseases could increase the risk of developing. Now, if we take one step backwards, what triggering those genes of disease, that's what we learn in functional medicine. What's the science of epigenetics, which is what turns those genes on and off, right? And now there are other triggers that are we're going to talk about. So for example, there's environmental triggers like UV light exposure, infection, certain medications. We're not going to go into the drug-induced disease or nutritional deficiency or all of that stuff. But just as a general general knowledge to mention, some medication could induce symptoms of lupus. So, for example, there's a couple of medications that were mentioned in the Lupus Foundation by the Lupus Foundation of America, mentioned that approximately 5% of those who take in hydralazine, which is a hypertension medication, and 20% of those taking procanamide, which is essentially a medication for abnormal heart rhythm, arrhythmias, will develop drug-induced lupus. So we know that, again, that's why it's good to have, with use of medication, there are the potential benefits and within managing the disease or symptom, but there's also, we have also to consider that some medications could have side effects or potential harm for patients, right? So this is where it's always good to learn the integrative medicine tools, because sometimes we've seen patients with hypertension that we applied a few dietary strategies, applied a few nutritional strategies, and some stress management, and their blood pressure reduced significantly, right? So sometimes you can help those patients without getting into more and more medication. Smoking is another one. Gut dysbiosis, there's specific pathways that can cause that. And then nutritional, which we're going to talk today in functional medicine, the functional medicine integrated medicine approach, about nutritional. So one thing to mention is vitamin D deficiency. There's some interesting report that lower vitamin D levels are commonly observed in lupus patients and may contribute to immune dysregulation. So this is really coming from excuse me, there's so many reports that we have on variety of autoimmune conditions that vitamin D is important for immunomodulation. If your patients do not have enough vitamin D, or they don't have the other cofactors that are required to activate vitamin D, they might be at higher risk of developing autoimmune conditions. And of course, chronic stress, trauma, we always have to consider those. And sometimes refer them or address the physiological aspect, which we are going to talk about today. So those are the general concepts, but that we want you all to be aware of when you see the next lupus patient. Just remember that interaction of, that interaction between the immune system, the gut, the endocrine, the environment, the genetic predisposition that can kind of, it's like the recipe, right? We're looking at the recipe and what systems could lead to all of this. So this is where we're gonna start diving a little bit deeper, and in our discussion class today. And Dr. Sarah, I feel like this is a good transition for going from like the general concepts and knowing contributing factors to kind of really diving deeper into, especially the factors that I know the next factor you're going to be talking about is really not talked about at all in the primary care offices. But most primary care practitioners don't mention it at all to their patients.
No, not at all. And it's what I call low-hanging fruit. Making dietary and nutritional changes is really just one of the easiest things that we can do and recommend for our patients, because it doesn't require them to, order a supplement and do all these things. They literally just have to go to the grocery store or their garden or, their local farm. So let's jump into, now that we have a good solid foundation on what lupus is, how it impacts the immune system, and also risk factors that could make your patients at an increased risk of developing lupus. Now let's open up our functional medicine tool bag and let's talk about some risk factors or really causes that could be underlying triggers for lupus. Number one, inflammatory foods. So, from a functional medicine perspective, we know that diet plays a central role in modulating our immune system, inflammation, and inflammatory processes, as well as just a total balance of the immune system as a whole. And so, inflammatory dietary patterns may contribute to immune dysregulation, particularly with symptom flares as well. And usually we see that increase in risk in those that are genetically susceptible to autoimmune conditions, particularly lupus. So, gluten has been shown to increase intestinal permeability or leaky gut in individuals by stimulating the release of zonulin. Zonulin is one of those tight junction proteins. And when we see an increase in zonulin, that is usually a sign of leaky gut or intestinal permeability. Now, a compromised intestinal lining can allow, as we know, microbial antigens, toxins, and undigested food proteins to enter circulation. And this is going to cause our immune system red flags to go up. And so they're going to start generating antibodies. And unfortunately, in the case of autoimmune conditions, they're going to start making auto antibodies against our own tissues and own cells. And it's also going to start provoking a systemic immune response. So, particularly an increase in the release of inflammatory cytokines. And then that inflammatory process just continues and continues, and certain protections and stopgaps are impacted. Now, it is unclear how gluten increases the risk of lupus developing lupus. However, let's take a look at a picture from a 2023 study in the journal Nutrients. Now, I wanted to highlight this because this is going to draw some connections between celiac disease and lupus. So here we see celiac and lupus up at the top, and the first box underneath it is nutritional deficiencies. So these are some of the common things that researchers have found in patients that have been diagnosed with celiac disease and those that have been diagnosed with lupus. Now, for those of you who may not know, celiac disease is an autoimmune condition that is triggered by the gluten protein that causes the immune cells or immune system to attack the small intestine and in some cases the colon. Now, nutritional deficiencies. When we have a diet that is rich in all of the good things, right? Fiber, omega-3s, vitamins, flavonoids, these all help kind of calm the inflammatory process and has been seen to be beneficial in both celiac disease and lupus. Now, there are quite a few environmental factors that play a role in the development of these two autoimmune conditions as well. So the microbiome, as Dr. Tall talked about, experiencing gut dysbiosis can be a risk factor for developing both lupus and celiac disease. Vitamin D deficiency is implicated in the development of both of these conditions, as well as certain stress issues as well. We'll also see a secretory IgA and a general IgA deficiency. So that's telling us that the immune cells, the primary immune cell in the gut, is reduced. And so our immune system is not making as much of that immune cell. And so that could lead to immune dysregulation as well. Now, what's interesting, and this is something that Dr. Tall is going to talk about in just a short while, but viral sensitization. If a patient has a chronic infection, particularly a chronic viral infection, that can actually impact the immune system and its ability to regulate and recognize self versus pathogen. And so in a couple of moments, Dr. Tall is going to dive into that just a little bit. Now, what we're going to see is that Interestingly enough, both of these conditions have a genetic component. And so researchers have found that there are certain genes that overlap between celiac disease and lupus. Now, researchers found in a 2012 Swedish study, it was a huge, large research study that evaluated whether patients with biopsy confirmed celiac disease were at increased risk of developing lupus. And what they discovered is that individuals with celiac disease were at a threefold increased risk of developing lupus compared to the general population. Now, that may not be too surprising because we do know that when someone is diagnosed with one autoimmune condition, their risk of developing additional autoimmune conditions is also increased as well. Now, patients with celiac disease have, of course, an increased risk of developing lupus, but particularly within the first year after their celiac disease diagnosis. So if you have any patients who have been newly diagnosed with celiac disease, supporting a good immune balance is going to be important to reduce the risk of developing additional autoimmune conditions. Now, this link between celiac disease and lupus remained intact even after accounting for age and sex, as well as socioeconomic status and so many other factors. So it's important for clinicians, particularly functional medicine clinicians, to keep an eye out for signs of lupus when working with patients with celiac disease. Now, not only is gluten a particular inflammatory food that you want to make sure that your patient is reducing out of their diet, we also, researchers have also seen a connection between increased meat consumption and it being associated with an increased risk of developing lupus. Now, there was one study in which strict vegetarians had a 25% lower chance of needing treatment for lupus in comparison to non-vegetarians. That study included over 77,000 participants from the Adventist Health Study. And they were 30 and over, and they had self-reported dietary habits, and they were diagnosed by their physician with lupus. Now, what we know is that diet can significantly impact and influence the risk of developing lupus as well as disease progression. And what a 2022 study in the journal Lupus found was that many lupus patients who changed their eating patterns to incorporate more plant-based foods and limited their processed foods, including animal products, they reported more improvements in their symptoms as well as their disease severity as well. All right, so now let's have our second quiz. So quiz number 2. Which of the following best explains how a vegetarian or anti-inflammatory diet may influence the risk or severity of lupus? Option A, it increases iron absorption, which reduces autoantibody production. B, it eliminates dietary proteins needed by immune cells. C, it lowers the intake of pro-inflammatory fats and boosts antioxidant levels, and that potentially helps reduce the overactivation of the immune system. And then D, it raises glucose, which suppresses the immune system and immune response. So take a moment in the chat, submit your answer, and let's see what you have. All right, the correct answer is C. So vegetarian and anti-inflammatory diets are lower in saturated fats, rich in antioxidants, and rich in omega-3 fatty acids. All of these components and nutrients are known to modulate the immune system and modulate inflammation and potentially reduce the severity of autoimmune diseases. So understanding nutrition and how to guide your patients towards better health is so important. And in fact, it's so important that we have included several modules in our Advanced in Clinical Functional Medicine program. So we encourage you to log back into your dashboard and refresh your memory on the food as medicine modules and a lot of the clinical nutrition modules, so that you can be prepared to support your autoimmune patients, particularly your lupus patients, with dietary changes to support their inflammation. So, Dr. Tall, I cannot wait for this discussion about the connection between chronic infections and lupus, because while most primary care doctors definitely don't talk about gluten and dietary changes, I don't think a lot of chronic infections are on their radar either.
Yeah, that's always an important topic to talk about, and of course, it's great to start the discussion with a topic such as clinical nutrition, because we know that by making, and I know you give, there's a couple of really great clinical pearls in the discussion that you mentioned, right? One of them is the higher consumption of meat, right? That can have a certain effect on our immune system, and it's important to understand that, and when appropriate, help the patient to find alternatives, and and have a more diverse diet, right? So they're not consuming meat or animal protein on a regular daily base all the time, right? So they reduce their risk of developing more flare-ups and all of that. Gluten is a big one. We talk a lot about gluten and the different nutritional aspects when we talk about the gut and the impact on the gut. Of course, not every patient is going to be impacted by it, but we have specific tests today to figure out what types of foods, even considered healthy foods, the patient might, your specific patient sitting in front of you might have an immune reaction, right? We're not going to get into that, but we dive much more in depth into foods and immune reactivity and all of that in the advanced program. But what we also wanted to mention is factor number 2. This is the next factor that is important to talk about. And factor number 2 is chronic infections. So this is one of the most well-studied infections contributors to lupus is Epstein-Barr virus. This is a herpes virus that established a long life latency in B cells. And in genetically susceptible individuals, the chronic or reactivation of the Epstein-Barr virus infection can drive autoimmune responses through several mechanisms. We're going to talk about a couple of those mechanisms in this discussion. So the first mechanism is molecular mimicry. The second mechanism is B cell activation and survival. So Epstein-Barr virus infect B cells and extend their survival, allowing more long-term harmful self-reactive cells to persist, which leads to ongoing antibodies production and loss of immune tolerance, right? It can also impair T cell surveillance. So in lupus patients, the immune system might have reduced what we call cytotoxic T cell control over the Epstein-Barr virus infected B cells, right? So again, if you got B cells that are infected, now you have ongoing immune activation and chronic inflammation, right? So we always like to keep things more visual, because that helps our brain to understand all the different concepts instead of just me spewing out different things. So let's take a look at an image from a study published in 2020 in the journal Frontiers in Immunology. And this study investigated how Epstein-Barr virus proteins contribute to the onset and progression of lupus. Very specifically, as we mentioned, through molecular mimicry and immune dysregulation. So There's different obviously concepts here, but I want you just to let's start with simplifying it. Let's take a look at number one. You can see in the center there where it has like two arrows and it says immune dysregulation. So we're really starting these to talk about these concepts with the talking about the increase in LMP1, right? You can see it right next to number one, right above it. There's something referred to LMP1, and this is latent membrane protein number one, right? So we'll simplify it. Latent membrane protein number one. This is a viral protein that is produced by the Epstein-Barr virus. This is commonly linked to infections such as mononucleosis and associated with several autoimmune diseases and some types of cancer. So this protein, right, LMP1, latent membrane protein 1, disrupts both the innate and adaptive immune balance. And this immune dysregulation further increases the expression of the latent membrane protein 1. So now we have a vicious cycle which the immune system is dysregulated and it keeps producing more of those proteins. Now in number two, we're going to move to number two on the left. LMP1 also stimulates interferon production by activating several transcription factors along with toll-like receptors. This is what you see, the increase in TLR7. So those are toll-like receptors, right? So it increased toll-like receptors. And then number three on the top right upper side, the type 1 interferon and adaptive immune activation enhance T-cell driven antibodies and autoantibodies production, which enable the cross-reactivity between the Epstein-Barr virus protein and lupus-related autoantigens, right? Now, number four, on the right side, these autoantibodies combined with chronic inflammation lead to tissue damage and the release of more lupus-associated autoantigens. And the final step, which is number five on the bottom, these newly released autoantigens activate toll-like receptor 7, which further drives both innate and adaptive immune responses, which sustains the autoimmune activity. So essentially what these authors are saying us, and you can see the citation on the right side, is that if your patient has an infection such as Epstein-Barr virus, the protein that viral infection is producing will cause the immune dysregulation and immune molecular mimicry, right? So essentially the takeaway from those is that these protein produced by the Epstein-Barr virus can mimic the body's own molecule. So the immune system comes in and it thinks, oh, this is a foreign, this is an infected cell, and they go to war, right? So one of those proteins, which I mentioned, the EBNA1, it resembles the autoantigen seen in lupus, right? While another mimics one of our own immune cells, which is CD40, which promote B cell activation. So essentially, the whole concept of molecular mimicry is that our body looks at our own cells and say, wait a second, this doesn't look like my own cell. I'm going to attack it and destroy it, right? The second key finding that the authors of this particular study were talking about is the high levels of inflammatory cytokines, right, such as interleukin-6, tumor necrosis factor alpha, reflect a shift in the immune response, right? So when patients have this ongoing Epstein-Barr virus, their patient's immune system is going to shift and is going to be constantly, the immune system is going to be on edge. Let's call it that. It's going to be on the edge. You're going to have a bit stronger response and more likelihood to autoimmunity. So Another example, maybe more simple example, is that if your patient has one autoimmune conditions, they have higher risk of developing another autoimmune conditions because your patient's immune system is imbalanced and it's already primed to attack its own cells, right? So that's something to remember. And this is really where testing is useful. Recognizing the symptoms is useful. Right. So let's wrap this section with a quiz. So quiz number 3: which of the following best explains how Epstein-Barr virus may contribute to the development of systemic lupus? And we get options here. So option 1 is Epstein-Barr virus reduces B cell activity and suppresses antibodies production. Option number 2, or B, Epstein-Barr virus proteins mimic self-antigens leading to cross-reactive autoantibodies production. Option number C, Epstein-Barr virus infection improves T-cell regulation of autoimmunity. And D, Epstein-Barr virus infection only affect individuals with active gastrointestinal symptoms. So which one do you think is the best explanation for how Epstein-Barr virus may contribute to the development of lupus? So you can put it in the chat. We're monitoring our chat. Want to see which one of you get the answer correct. So share it in the chat. I'll give you a few seconds to think about it. And then the answer is B, which is Epstein-Barr virus proteins mimic self-antigens leading to cross-reactive autoantibodies production. Right. Now, if you are interested in learning how to support your patient's immune function and a healthy response, log into to the Advanced and Clinical Functional Medicine platform and watch the class Functional Immunology. This is one of the very, very, very important fundamental classes that talks about very specifically how can we impact the function of our immune system? How can we achieve better balance? How can we impact different parts of our immune system? How can we prime an immune response for reducing the risk of infection or developing complications, right, due to infections? So, and we give some great examples from published studies about COVID and other different infections, and we give some examples from autoimmune conditions. But that's a really important class to talk about how certain compounds and nutrients and exposures and what can impact our immune system. That's really important. So it's called Functional Immunology. Check it out on the platform. So Dr. Sarah, I feel like there's so much we can talk about, right?
Truly, yes. Oh my gosh, we can go so many different directions from there, right?
Absolutely. And this is the next one. So we talked about nutrition. We talked about opportunistic infections that might increase the risk of developing lupus. The next one is also the next factor, contributing factor, is also a very big. It's a big factor. It actually involved in play a role in so many chronic conditions, and it's rarely discussed, again, in primary care offices. So this is why I'm so glad you are going into and talking about this important factor.
Yes, and it's one of those risk factors that is ubiquitous. I mean, who isn't stressed? Who isn't under chronic stress? So the third sort of root cause to the development of lupus is chronic stress and HPA axis dysregulation. So this is a really great thing to consider, or factor to consider, especially if you're thinking about a lupus patient and you're like, well, they're already off of gluten, or maybe they don't have celiac and they don't have Epstein-Barr. I've already checked for these things. I can assure you they're probably under chronic stress. So this is a great factor to address and to support their immune system and a proper immune function. So earlier, Dr. Tall mentioned how the Epstein-Barr virus can actually tip the balance between T helper cell activation types. So there's T helper cell 1 and T helper cell 17. They both activate inflammatory pathways, but they lead to different symptoms, different clinical presentations, and different immune responses. Both are inflammatory. Now, chronic stress, so the continuous release of cortisol, enhances that Th1 and Th17 activity. So it promotes pro inflammatory cytokine production, and actually disrupts our regulatory T cell dysfunction. So remember, our regulatory T cells are like our fire extinguishers. They come out after the cytokines have recruited all of the important immune cells. The immune cells have already gone in and cleared out all of the pathogens or whatever it is that they were attacking. And the regulatory T cells come in and cool down that inflammation and begin the process of healing and kind of restoring homeostasis. But chronic stress, chronic release of cortisol, prevents regulatory T cells from turning that inflammatory switch off. And when that happens, that's when we kind of set the stage and begin to contribute to autoimmunity and lupus flares. However, in lupus patients, we might actually see something a little bit different happening. So let's take a look at an image from a 2019 study in the journal Frontiers in Neurology. Now, on the left-hand side, we see here, we have the brain, and this is where we have our pituitary gland. And our pituitary gland, we have the process of releasing cortisol. So we have cortisol, corticotropin releasing hormone that triggers the anterior pituitary gland to release ACTH, or trigger the adrenal glands to release ACTH. And then ACTH also plays a role in the adrenal glands releasing cortisol. And so cortisol is released. We get a stress response in response to either a physical stressor or a psychological stressor. And then the presence and levels of these corticosteroids, corticosterone and cortisol, they actually provide a feedback loop. So that dashed red line shows how when we have elevated levels of cortisol, our brain says, oh, okay, great, we have plenty of cortisol, we're able to manage this stressor. So let me turn all of the other processes off. So this is what happens in a normal stress response, in a normal situation. Now, when we look at B, the right side of the image, we have the same situation. We're going to have a trigger, but this is what happens in an altered stress response. So there's some sort of trigger, a psychological or physical stressor. It triggers the release of the corticotropin releasing hormone. That triggers the anterior pituitary to actually suppress ACTH. And if ACTH is suppressed, that decreases how much cortisol is released from the adrenal gland. And when we have decreased cortisol being released in response to a stressor, that means that we have a significantly lower negative feedback loop. So our brain is saying, oh, well, we're making cortisol, but we're not making as much. So let's keep sending the signal so our pituitary gland can wake up those adrenals so they can start making more cortisol. So this altered stress response is a phenomenon that we do tend to see in patients with lupus. They have what we call a blunted cortisol response. And inherently, you might think, oh, well, they're making less cortisol. That could be a good thing. But as we mentioned in the image, when they are making less cortisol in response to a stressor, that prevents that negative feedback loop from activating, and that stress response doesn't quite get a chance to turn off completely. Now, studies have shown that people with lupus, many people with lupus, have a dysregulated function of their HPA axis and their stress response. So they produce less cortisol compared to the really high levels of inflammatory cytokines like IL-6 and TNF-alpha. Now, this imbalance between cortisol and those inflammatory cytokines makes it harder to control inflammation, and that leads to continuous activation of the immune system, and eventually will lead to tissue damage. So now that we've kind of covered those three main factors that are associated with the development of lupus, so eating and consuming inflammatory foods like gluten and having a high protein, high meat consumption diet. Number two, chronic infections, particularly an Epstein virus infection. And then we just got done talking about the importance of having a balanced HPA axis and how chronic stress can actually kind of exacerbate that stress loop and prevent things from being turned off. So now that we kind of added into our toolbox kind of things that we can, or areas that we can support our clients in, Dr. Tall, when we're looking in our toolbox, what is kind of like the first thing that you reach for when supporting a patient with lupus?
Yes, that's a good question. So the first thing, obviously, we want to look at the root causes, right? And we talked about several of them. Are there other infections or other inflammatory processes in the background that can continuously kind of contribute or trigger flare-ups, right? Is there ongoing stress or dysregulation of the HPI axis, right? That's going to be really important. You mentioned cortisol and the importance of really understanding if your patient's HPA axis is working properly. Are they producing cortisol in a normal amount? And as you mentioned, cortisol is important for immune regulation. And if they don't, then you need to address that. There's very specific protocols from stage 1 to stage 4 of HPA dysregulation. Unfortunately, it's not something that is taught in the mainstream approach. So that's something we do dive deeper in the functional and integrative advanced training. But that's all important because it can make a big difference if we start identifying based on the signs and symptoms what it is that we can start doing right now to help the patient, right? Yeah. And then, as you mentioned in the approach, our foundation is always nutrition and healthy environment, right? Stress management, like that's really the foundation of good health, right? And it makes sense. I mean, I don't think there's anybody here that is sitting, listening to us, watching us saying, well, nutrition is not important, right? for healthy function, right? I think at this point, we already established that if your patient's nutrition diet is not good, let's just call it not good. We're going to oversimplify it. Just go not good, right? Or bad, right? It could lead to, there's like so many things that can happen. One, they're not going to get enough of the important nutrients like vitamin D. They're not going to get enough of that. They're not going to get enough magnesium, which is important, or zinc, which is important for a healthy immune response, right? So there's all these nutrients we have to get, right? And then if they're eating what we call inflammatory foods, then that's okay. That's a whole story, because now you're giving them a medication or a certain protocol to reduce the inflammation, and they go home and they keep putting things in their body that flares up things, right?
Yeah.
So this is why the kind of strategies we want to talk a lot about are, we do have specific protocols and we dive deeper into each autoimmune condition and what are the specific like herbs and compounds and very specific protocols for lupus, right?
Yeah.
But what we chose to talk about today is really the things that your patients can do right now, right? You can give them the options. You don't have to spend 30 minutes on it. You can just, every time they come into your office, like talk about like one small strategy, right? So for example, the one strategy that we can talk about is increasing omega-3s, right? That's a simple strategy we can talk about. They can do it very simply by eating more fish, or they can just take a good quality omega-3 supplement. So We typically want to start by increasing their omega-3s because that has more of an anti-inflammatory, put them on more anti-inflammatory pathways. And we can simply do it by asking them to take 3 to 4 grams a day of omega-3. It's quite simple with a high quality supplement, from companies such as Vital Nutrients. You can find it in like 2 little soft gel pearls. You can get to 3 or 4 grams a day. Very simple, and most patients are already used to taking pills, so it's not a big deal for most patients, right? Over the long term, it's not a magic pill, but over the long term, we're looking to start reducing that flare up and inflammation. Reducing, I don't like telling patients to don't eat meat or reduce your meat consumption. It's hard for them, especially if they like their burger every day or their chicken and all that stuff. So what I do tell them, I ask them simply, what can you do 3 times a week to replace your burger or the chicken that you're eating every day? Like, what can we do to replace? Can we replace it one day with fish or seafood? That if they say yes, great. Now we got higher omega-3s already. Now we don't want it fried, right? We don't want it fried. We want it to be preferably, it could be stir fried, not deep fried, but stir fried. Grilled is not ideal, right? It's better if it's baked, but most restaurants will serve, it might be easier for them to find grilled or just on a pan, right? So that's okay too. We're going to increase the omega-3s. And then what else can we do to replace meat consumption? Maybe eating more whole grains, legumes, vegetables, right? Those could be useful as well. So that's something we want to make sure to do, right? So for example, one day a week, instead of eating a burger, you can stop by a Chipotle and get yourself brown rice, a bowl of brown rice with black beans, and throw in some guacamole, right? So now you're getting, it's still considered fast food, right? But now you're also getting a lot more of the vegetables. You're getting some whole grains. You're getting some legumes in there, right? And that does three major things. One is more antioxidants to protect your tissues from oxidative damage, which is known. It's a known driver in lupus flare-up that cause tissue damage, right? You got inflammation, that flares up, things cause more oxidative stress, then you got free radicals coming in and damaging your tissue, your cell, your DNA, all of that. If you're eating more whole grains and legumes, you're also increasing your fiber, which is great. We want more fiber because fiber promotes the healthy gut microbiome. And we're not going to get too much into it, but if you promote more healthy gut microbiome, you have higher production of short chain fatty acids, which some of them have anti-inflammatory effect. And now, if you're having a more diverse food with legumes and whole grains and vegetables, now you also have higher content of the different vitamins and minerals, right? You get more zinc, folate, magnesium, vitamin D. So those are really crucial for immune regulation and tolerance. So this is where, every time I would see a patient, I would just give them like 1 or 2 recommendations. I would ask them, like, how can you do just this one thing for the next 2 weeks? How can you do this just one thing, right? Small changes, give them a couple of weeks or a month to adjust, right? Let them come up with ideas how they can do that. So, and if there's a lot more to it, but we're giving you tips, me and Dr. Ellis right now, because we want you to start thinking in a more comprehensive way. It's like, how can I offer my patient these services and more a comprehensive approach so we can get better results, right? So Dr. Ellis, I know there's a lot we can talk about when we talk about lupus, right?
Yeah. Quite a bit.
Yes, quite a bit. This is, by the way, the time for, we'll have time for 2 or 3 questions today, so you can put them in. And one thing that I wanted to mention before we go into the questions, and we'll give you guys like 2 or 3 minutes to kind of put in the questions. And I wanted to give you a little bit of an announcement of something that is coming up, and I want to make sure that everybody knows about it. And that also gives Dr. Ellis some time to look at the questions and see what's the best way to answer those questions. So if you're interested in learning more about the root causes of autoimmune conditions and other chronic conditions, and want to learn about more specific treatment protocols, I would recommend to log into the Advancing Clinical Functional Medicine program. That's where you're going to continue to learn. We got 12 different specialty classes, from autoimmune to chronic pain, degenerative joint conditions, neurological, cardio, metabolic, whatever it is that you've seen in your office right now, we probably got it, right? Whatever chronic conditions, hormone imbalance, right? Whatever it is, we probably have the module. You see in pediatrics, we got functional pediatric class, right? We got you covered when it comes to functional medicine. But I wanted to kind of talk a little bit about the changes that are occurring in the functional medicine. So as I mentioned before, the functional medicine program is very comprehensive. So you got, in the first three to 5 months, phase 1, you're going to learn about all the root causes, right? All the different root causes and labs and all that stuff. Then you already know how to do the entire functional medicine system and use it to help your patients. In the second phase, we're going to go into the 12 different specialty classes to really make you the go-to person in functional medicine for your community, and also include the practice growth systems. We have a 6-figure functional medicine practice blueprint. We are starting the practice building accelerator very soon. I think it's next month, with me and Dr. Chill. So it's going to be a lot of fun. If you're interested in learning how to build a successful practice, you should join us. It's going to be a lot of fun. And of course, a lot of those bonuses are included with anybody that enrolls and for our current community members. What I did want to mention is that we just got a note from the operations manager that the price for the advanced functional medicine program is changing at the end of this month, in June. So the promotional price, which we had until we had so far, is going to be over at June 30th. And then the price changes, right? So if you're interested in enrolling in the functional medicine advanced program, you joined us today as our guest, this is the best time to check it out this month, because the price is going to increase significantly. So now, one thing to mention is the price increase will not impact anybody that is already enrolled in our program, because you're already grandfathered into the program. So we're not, any changes, they're not going to get impacted. You're not going to get impacted by you, right? That also includes the new directory of practitioners that is coming up very soon. That will essentially, every graduate of the academy will be posted on this directory, and it will also include your own website that the academy will create for you to kind of showcase your certificates and all that stuff. We'll have some marketing features to it, and we also help to promote your practice. So you're going to get that when you enroll and you get in our program. But we want to make sure that everybody knows about the price increase, which will, again, not impact our current students. They're going to get grandfathered into the promotional price. But anybody enrolled after July 1st is going to pay significantly more than others. So we just want to make sure everybody knows it. No surprises there. We like to keep things very transparent. So we're going to post the link. If you here as our guest, you're always invited. We're going to post the link to the application. It's only for healthcare practitioners. Obviously, this is an advanced program, but you can feel free to apply. So Dr. Ellis, and by the way, the link to apply for the program is right there on the screen. So it's just the www.theafh.org/FM for functional medicine bonus from promo 2025. So check out the more details about the program, what's the June promo bonus includes, and we also post there the current pricing and the price increase from July 1st. So we want to make sure that we're keeping it very transparent so everybody knows. And again, if you're already in the program, you enroll in this month, it's not going to impact you. You're already grandfathered, so we're taking care of you. You don't have to worry about any of those changes. So, Dr. Ellis, you want to take us into the questions, and
let's do it.
I'll let you answer those. Yeah, go ahead.
Sounds good. We have a couple of questions. You all still have time to submit your questions. So if you're on the fence, just go ahead and put it in the chat. All right, first question. Can this pattern with cortisol also be seen in other autoimmune conditions? Wonderful, wonderful question. I have seen research seeing a blunted cortisol response or cortisol release in 2 other autoimmune conditions: inflammatory bowel disease, so Crohn's and ulcerative colitis, as well as rheumatoid arthritis. And so in those 2 conditions, researchers have seen a similar pattern with a reduction in the production of cortisol and then less of effect from that negative feedback loop. But that's a really great question. Did you want to add anything, Dr. Tall?
No, I think that was a good answer. It's essentially we know that the HPA axis, as you mentioned, it just plays a role in so many autoimmune condition. I'll share one of this is not based on clinical study, but this is just based on my own kind of empirical knowledge of being in healthcare for over 20 years. One of the first signs of HPA dysregulation is that patients report, or when you ask them, they mention that they have a hard time, they struggle with anxiety, or they have a hard time dealing with stress. Mm-hmm. I noticed that there's a very strong association between a patient that has lost that physiological response, stress response, right, with the entire cycle that you mentioned before. And that typically is presented as anxiety, tendency to anxiety, right? And difficulty to manage stressful situation or deal with stressful situations, right? And we leave it at that because we have a whole training on the HPA axis and the endocrine factors that are involved with that and how you can treat it and also how to lab test it, because there's very specific functional lab tests that can measure that.
Exactly. Yeah, so good. Awesome. So our last question, this is such a good one. I have a patient with resistant hypertension, kidney disease, and lupus. She is an African-American female, and she's also a diabetic, so she has a double whammy. I'm finding it difficult to get her to comply with diet modifications. She feels as if there is nothing left for her to eat. LOL. So really great question. And I think this is really a good place to talk a little bit about meeting patients where they are, right? So one of the things that when I think about like resistant hypertension, kidney disease, and lupus, all 3 of those conditions involve inflammation, right? So reducing her inflammation is going to be key. But that last factor that we talked about, that chronic stress piece, that reduction in producing cortisol, that is one of the perfect areas for you to maybe begin to adjust while you kind of start a little bit slower with diet modifications. In my experience, small changes over a longer period of time sometimes can be more effective in getting patients to be more compliant rather than kind of flipping their diet in a 360 degrees overnight. guide her toward, you can try to guide her towards an anti-inflammatory diet, which really hopefully shouldn't be too far from where you want her to go in a dietary with her dietary modifications. And then one thing that I find can be helpful with clients when they're making and patients when they're making dietary changes is pairing like seasonal foods. So this gives them a chance to have like an experiential part of it, right? So if foods are in season, they're going to smell better, they're going to taste better, and she's going to be more willing to eat those foods because they taste better. So have her, visit her local farm and um, get more involved in the process of selecting her food and hopefully not feeling so stressed out about what to eat. So that could also be causing a lot of stress and worsening her altered stress response. So try to meet her where she is. Start with little steps until she reaches that final destination of following a really good, solid anti-inflammatory diet, especially focusing on some of the elements that we talked about today. What about you, Dr. Tall? What recommendations would you give her?
Yeah. So as we know, sometimes in functional medicine approach, the hypertension or the kidney disease or the diabetes, right? They sometimes they have like, it's kind of like a tree, right? If the roots are, if we keep spilling, if the root doesn't get enough nutrient, or there's some toxicity in the land, or we keep spraying pesticides, for example, whatever it is, right? There's going to be different manifestation. And sometimes I'm giving the analogy of it roots in the tree system, because sometimes it is related, right? As we dive deeper into the root causes. When it comes to, so sometimes I will just kind of focus on maybe one thing at a time. That's something that I've done before. Sometimes it works well, sometimes it doesn't, right? But sometimes you get a patient with hypertension, with lupus, with this, right? And sometimes it's easier to just say, okay, you know what? Let's just, you got diabetes. Well, what's more important? What's out of control? Why do we need to focus? Let's just pick one thing. Okay, your diabetes, your hemoglobin A1C is like 8.2. Okay, well, we know that this would be maybe a priority right now. So maybe one thing we can focus on is swapping sugary drinks with some cold water, some lemon juice into it, a few drops of lemon, and some stevia, right? And then just give them like maybe a couple of weeks just with that. Just try it. Like instead of drinking soda drinks or energy drinks, or putting sugar in your coffee or tea, maybe just add stevia, right? So we're just giving them like one thing to focus on as a habit. I'm not going to change everything else they're eating, the potatoes, all that stuff. I'm just going to say like, for the next week or two, let's just do this. Let them adjust to it, right? So they come back, they're like, okay, now we reduce the sugar. Great. Now let's talk about the next thing, right? Maybe the next thing is because of hypertension. Okay, hypertension. Instead of overwhelming the patients, I used to do that when I first started. I was like, oh, hypertension. Yeah, hypertension, the DASH diet. I was like, and I was so excited about it. I was like, the DASH diet. I'm looking at all the research and I'm like, this is incredible. It can help reduce blood pressure naturally and all that stuff. And then I would come in back to the room with sometimes a printed like DASH diet. And I'm like, and I'm given it to the patient and I feel like victorious, right? Only to hear from them when they come back that they applied like zero of whatever I told them, right?
Yeah.
Or they try to, and they're like, well, it's not going to work for me because it tastes like, there's nothing here that I can do. There's nothing left for me to eat, right? There's nothing left for me to eat. We hear that from patients so often. If I'm going to take this and this, there's nothing left. What am I going to eat, right? So maybe, as we learn the concepts of diets, it's sometimes the really useful thing is to ask ourselves, what from all these different concepts of the DASH diet, what is the one thing that can really make the biggest impact? Like just one thing, right? So, for example, with the DASH diet, obviously it's reducing salt, right? So one of the things as I kind of began experience, right, or you work with a mentor, like you have Dr. Chill and Dr. Ellis, you can, when you're in our program, you can connect with them, bring a case study such as this, right, and then bring some of your functional labs as well, so we can kind of have a discussion and help you. But sometimes it's helpful to, instead of like throw the DASH diet principles at them, just say, well, you know what, maybe how can we swap salt for something different that'll still give you that salty flavor, right? And so I'll give you an example. There's Bragg's liquid aminos is great. There's also spice seasoning made from herbs that can also give a lot of flavor, and it's significantly reduced amount of salt, so you still get that salty kind of flavor, but it has less of those of the sodium. So if you're interested, it's just called Bragg's. It's Braggs. It's called Bragg's amino acids. And you can buy it as a spray to add it, to spray it on salads. I used that for a while. I tried it myself, and it actually tastes pretty good. You can use, there's like a no salt salad spice, which is essentially like different herbs, dried herbs that they can add. So I would say it's, if we try to eliminate all the stuff that they like to eat, we might lose them as a patient. We have to think about it. We might lose them as a patient. It's like, it happened to me when we used to have one of the biggest successes that we have in our practice was that the diabetes and neuropathy programs. And we would have a very honest conversation, very transparent conversation with the patient. What are they willing to change and what they're not, right? And if they say, listen, I'm open to your suggestion, but I like my potatoes, then we know, okay, they're coachable, they're willing to do the work, but we're not going to go to potatoes. We're not going to touch their potatoes, right? We'll work on everything around. So every time we'll have like one recommendation, and every time, and then when they come back, we'll give them some time to implement. They come back, we'll give them another recommendation. Guess what happens 4 to 6 months into it? If you have the right protocol for neuropathy, you help to improve nerve function, you reduce inflammation, and then you help regenerate the nerve. In so many cases, we have seen patients with 100% reversal of their neuropathy within 3 to 5 months. And then they come back. Now, many of them are more open, right? You show them your magic, you show them your skills, you show them the benefit. Now, some of them might be open to, okay, let's talk about what other things I can eat beside potatoes every day, right? My potato chips or whatever it is, right? So hopefully that helps you. Just one thing at a time.
Yes.
And that's the general approach.
Yeah, they actually responded, I love this advice. We will start small. We begin working together next week. She's extremely depressed about being overwhelmed with the lifestyle modifications. Thank you. Yeah, it's a big change. And one thing that I constantly have to remind my patients, especially if they're presenting with chronic diseases like hypertension and kidney disease and diabetes, is that you've likely had these diagnoses for decades. So it's not going to be an overnight reversal. It's going to take time. It's going to take some patience, and remind her that she has you by her side to guide her along through the journey.
Exactly. And for us, for you as the practitioner, of course, you want to keep developing your skills, and you want to get better and identify the root causes, and especially you want to have different tools in your toolbox, right? So you want to learn more about the integrative medicine approach and the different strategies and all of that, because that allows you to really pull the right tool for each one of those, not just conditions, but also the patient tells you, well, I'm not going to do this, but I'm willing to take a supplement. Okay, no problem. We got that ready. We got the different protocols for which supplements you can add in a simple pill form. You can take it in the morning, evening, and then you're done, right? So you want to have more tools, and you want to keep growing your skills, developing your skills, because that allows you to better fit the treatment for each patient, right? And then to finish up our discussion for today, there's a note here. I think it's the first question about cortisol. Since this is the case, would you have to wait for cortisol testing to come back, or can you do something sooner? So typically, if you well verse in understanding the mechanisms of the HPA axis and the kind of like the symptomatics and signs and symptoms, I would recommend typically to start using one or two strategies from the protocol, from the treatment protocol. And it also depends on like how bad do you think it is, how much does the HPA axis really impacts the disease. In some cases, if I see the signs, it's like I see a lot of those warning signs, like, okay, let's order you the lab kit so we can test, we can figure out what's your cortisol's doing during the day, morning, nighttime, before you go to sleep, like what's happening there, right? And then I'll give you the treatment protocol. What I want you to do is fulfill the lab kit in next week or so, and then start the protocol that I'm going to give you, right? So essentially what we're doing is we're testing, but we're not waiting a month and a half until the lab comes back, until the next appointment, until we get the results, because they're going to continue to struggle. So one of the best, at least let's call it pro tips, is what I learned is like order the lab for them, or let them order it for themselves. But give them the protocol and tell them, as soon as you get the sample fulfilled, start on the protocol. We'll get your results. We'll know where you are right now, but we also don't want to wait. We can get you started on the treatment as soon as you fulfill the lab sample and send it up, right? And that way you get both of them done, and you get treatment started sooner. I don't know if there's something you want to add to that, Dr. Ellis?
I actually had a question for you. When you have them start on the protocol after they've submitted the sample, is it supplements and herbs? Is it lifestyle, diet and nutrition? Which tool are you pulling out of your toolbox first while you're waiting for the results?
Yeah, that is a good question. So the way that I like to think about it is I typically want to have one strategy from each one of those.
Yeah.
Right. Because what I found that is happening, and of course there's always going to be a patient that sits there, and if you've done your job properly in terms of your marketing and presentation, they're going to show up as you are the go-to, the expert, the health expert. They're going to show up, and we've seen it very, very often in our practice where practitioners will walk in and they would be like, wow, these patients come in and they're showing up with a notepad and a pen and paper, and they're actually writing everything I'm saying. I'm like, yeah, that's because we do a really good job on priming the patient before we actually start talking about the treatment protocols. And if you want to learn more about that, we have the Practice Accelerator program where we talk a lot more about the patient engagement and filling up your schedule, all that stuff. So that's coming up next month. But one of the things that I like to do is really give them one strategy from each, because one, we don't want to overload them with 6 or 7 supplements on their first time. It's just going to be too much, maybe financially too much, maybe too much pills to swallow physically. Also, giving them like 5 different nutritional strategies, the likelihood of them actually implementing it goes down with each additional strategy you give them, right? Yeah. So what I recommend is just one strategy. It's like, okay, let's simplify it. Let's do one strategy, one supplement for reducing inflammation, maybe, right? So we got that taken care of in the meantime. Dietary-wise, what is the one thing we can do to start moving them, shifting them from pro to anti-inflammatory, right? Like one strategy, simple, and something they can do. If it's something that they can't do, then obviously we'll choose something else. But one is the one thing they can do, right? That makes sense. And then lifestyle. For example, sedentary patients, which unfortunately so many patients are.
Yes.
What is the one simple thing they can do right now? Can they do a 10 minutes walk after lunch? Simple. 10 minutes walk. Just get out of the desk, walk 10 minutes. Walk around your building. How long would it take you to walk around your building? 10 minutes, great, just do it once. Walk around the building, walk around the parking lot, right? So I want to create momentum. And then when they're coming back 2 weeks later or a month later, I'll ask them, how was the homework that I gave you? Did you do your homework? If there's challenges, I'll help them to maybe give them some ideas, or maybe they will give me ideas how it's better to do that. And then I'm going to use the compounding effect by telling them, okay, now that you've done an amazing job of doing the 10 minutes walk around the block after lunch, how much would it take? Let's do two rounds around the building. So now it's going to take you 20 minutes. Okay.
Yeah.
Right. So I always want to compound on top of that. Always want to compound on top of that. Simple things. But I want that compounding effect, right? Because we might think, oh, it's just 10 minutes. 10 minutes walk around their building where they work or live, or their neighborhood. That's not 10 minutes is nothing, right? But 10 minutes times 30 days is now 300 minutes that they're walking, right? So we got them from doing 0 to 300 minutes every month, right? So remember, small steps, but it compounds over time, right? So yeah, good questions. I feel like we had really great questions.
Yes, we did. It was a great conversation tonight. Thank you all. If you didn't get a chance to answer your questions, feel free to email us. And we look forward to seeing you all next week.
Absolutely. And for any of you in our community, book a call with our coaches, our medical coaches. We're here to help you. We're here to give you some more strategies. Use the functional medicine evaluation form with your patients, because it will show you as a screening tool. It'll show you what the root causes are and make your life a lot easier, save you a lot of time. So show up you can fill it up yourself, show up for a coaching call. You can fill it up for a friend, family member who needs some health support, or even a real patient. So thank you so much for being here. Thank you so much, Dr. Alice, for sharing your experience. And
thank you for having me.
Yes, absolutely. And thank you, our media team, for allowing us to be here virtually with you wherever you are. And of course, thank each one of you. Big thank you for being here and doing everything you're doing, contributing, helping your patients, being kind of like the light and bringing hope for those patients who continue to struggle otherwise with their chronic conditions. So thank you for everything you're doing for your communities. We appreciate each one of you. So take care in the meantime, and have a good night.
Have a good night, everyone.